Welcome back, everybody. This is your Feel Good Breakfast show. Now, continuing with our health discussion on the second wave of COVID-19 infections and the recently discovered new variant of the disease. Now, Infectious Diseases Specialist and our friend Dr. Emile Reid is still with us and will be telling us more. And if you have any questions about the COVID-19 second wave, please do head on over to the line. It's 021-110-552. We'll be taking all of those questions for the doctor this morning.
And it sounds like we've got a caller on the line as we speak. Sheena from Durban. Very good morning. Sheena, are you there?
Good morning, Expresso. Good morning, doctor.
Sheena, thank you so much for weighing in. What is your question?
My question, doctor, is my husband recently had a bypass surgery and he came home 2 weeks ago. On Thursday, he tested positive for the COVID, and on Saturday, my two daughters tested positive. I just want to know, he's got all the antibiotics and vitamins, but he still has a chest pain and a phlegmy cough. Is this related to the COVID, or is it part of the healing process from the operation?
Well, Sheena, I think what is important is to remember that your husband is at extremely high risk to contract COVID and also develop complications due to COVID. And we do have an entity called long COVID, which means that frequently people that develop severe COVID normally develop symptoms long after they have already gotten better because of the COVID itself. It is important that the attending physician checks out your husband, make sure that he does not have a secondary infection which was acquired during hospital stay, and also rule out that it's not just the COVID making him ill as well.
Okay, thank you so much, doctor.
Sheena, and all the best with your husband's recovery as well, and good luck with your family. Hopefully you can all stay safe.
Thank you.
Absolutely.
Okay.
It just brings it home. So many people either have someone in the family, know someone. I mean, I've had a couple of people that have been quite close to me in the last couple of weeks now present, some in hospital, that were strong, that were healthy, that weren't presenting any comorbidities, obviously highlighting the new variant in COVID that you've explained. We've obviously seen an upswing internationally. What is going on in the rest of the world at the moment? Is this new variant? We've heard now that it's not the same variant from the UK. Is there any link whatsoever? This new variant, is it something that's born out of South Africa's exposure? Could it have come from somewhere else? Could we have spread it there?
No, definitely not. I mean, the development of variants are just a normal part of the evolution of the virus.
Okay.
And what has happened in South Africa is probably happening all over the world. And the important thing is that when the genome of viruses are changed, they actually causes different diseases. It actually influences the manner in which the virus behaves, which means it can cause different populations being affected. It can cause an increase in transmissibility, as what we're currently seeing. It can cause an increase in disease severity and complications, which we are luckily not seeing with this current variant. And the important thing that people need to remember, that genomic surveillance, what's currently happening, is happening all over the world. So whenever there is an infection, whether TB, HIV, malaria, now COVID-19, we constantly look at the species and the variants of diseases, and it actually helps us to respond to these diseases with regards to diagnosis, treatment, and vaccine development as well.
I think we've got another caller, Jocelyn, on the line from Milnerton. A very good morning, Jocelyn. What's your question?
Good morning to you, Graham, and the doctor, and
good morning.
Next to you. Thank you so much, doctor. I am a type 2 diabetic. What do you suggest I use for the over-the-counter self-help medication to boost my immune system, please? Because this skin is scary.
Thank you, Jason.
Great question. Yeah.
I think the important thing is that we need our immune system. And in order for us to stay healthy, to exercise, take our vitamins, vitamin C, vitamin D, zinc, selenium, all those important so-called immune boosters will help us and assist our immune system to cope with the current surge of COVID-19. And then obviously to follow the protocols that's been installed with regards to public health precautionary measures, stay in your house, wear a mask when you go outside, and sanitize.
I'm going to ask this very quickly. Are we going to get a vaccine? We've heard about, securing 10% of COVAX-related vaccine early parts of next year. Can we rest any hopes in a vaccine in the foreseeable future?
I don't think people should. I think we need to stick to what we know, and that is to protect ourselves. I don't think we should invest all our confidence in a vaccine, because we don't know when the vaccine will be available and when enough people will be vaccinated in order to cause herd immunity for us not to be able to transmit this virus. So I think the current feeling is COVID is going to be with us for a long while still to come, and we need to stick what we know best, and that is to protect ourselves and our loved ones.
Just remembering when you came on almost a year ago and I asked you, what must we expect? And Dr. Reid said, right off this year. Wow. Look at where we are now. So stay tuned to your Feel Good Breakfast show. Dr. Emile Reid will be answering viewer questions on COVID-19. Keep those questions coming.